Hi, everyone. Welcome to Crushing Doubts Q&A every Monday, 6 p.m., 3 p.m. Pacific, 6 p.m. Eastern, 3 p.m. Pacific. Good to see you all. I'm here on YouTube as usual. I'm also here on Instagram again after being out last week from Instagram. We couldn't make that work because I was away. We're back. We're also here on Facebook. It's really great to be here with you all, and happy 4th of July. Hope you guys are having a good holiday weekend. If you haven't already, click subscribe, ring the bell for notifications, hit like if you like what you're hearing, and put your comments below, and I will get back to you personally. Okay, guys, we've got some questions preloaded as usual. And if we've got questions as they come up, just fire away on whatever platform you're on, and I will get to them. Okay, let's pull up the first question that we have preloaded in. I think it's from Claudia. That should be coming up any second. Here it comes. Okay, Claudia M. Can you give an example of how to channel the anger to become more powerful? I would like to be more clear in the how, especially if you feel anger for a past episode in your life every time you remember it. How to move on and transform that anger into power. Great question. Let's please leave this one up because I'm going to need to come back to it on a couple of things. So first of all, to be able to do the how of things is really a big part of the question that people are asking about everything, and that makes sense, and I understand why. So I'll do my best, and you guys should ask follow-up questions as needed. So first of all, it's very hard to be powerful with your anger if you feel at its mercy and you don't understand it. So the first step is to understand it, and the first thing you want to do is to validate it for yourself, to say, I know there's a reason that I feel the way I do, and let me get more specific about it. I say this a lot of the time. You got to get more specific about whatever it is that's going on for you to understand that anger. If you're going to move on from it, it's got to be put away somewhere. And that's really how I deal with doubt. That's how I deal with the power column. Whatever it is, it needs to be organized, it needs to be understood, and then it needs to be put in a way of thinking about things where you can put it to rest. Here's a great example. This podcast is an example of that. I was very, very angry with a lot of people in this. I see Dorothy saying hi, and Julie saying hi. Gina, good to see you. Molly, good to see you. And Terry on Instagram. So we've got a lot of people here joining us. Thank you. I was very angry with a lot of people when it came to getting better, or not getting better for that matter. I was mad at the doctors for not understanding their own profession or what their role should be. I was mad at psychologists for the way that they handled things, including things like when I tried to see a specialist in mind body work and he couldn't see me because I was already seeing a therapist. I was like, I need help. I don't need rules. I need help. And so I was very angry at lots of different people. And what I decided I would do once I got better is to channel that anger. This podcast is a channeling of that anger. I have taken the anger I felt there and decided to do something about it. So I used the anger as fuel. That's one example. Another might be if your parents didn't do well by you and then you had kids. You can channel your anger by saying, you know what, I'm going to make sure I do better for my kids. Not in a way that puts pressure on yourself, but in a way that takes that anger and kind of bashes the world where it belongs, to make sure that your kids get the things that you needed. And that can give back to you. Those are two ways to channel aggression. We can talk more about it. And please let me know if you have more questions with that. I see Kathy Smith on Instagram. Saraj Singh, I think this is the first time I'm seeing you here, so welcome. And Rhonda, good to see you. All right, let's pull up another preloaded question since we don't have live ones going just yet. I see Carrie Nordling on Instagram. You guys are old friends. It's good to see you. So this one is from Natalie B. She says, the doubt part is fear of another symptom because as persistent and at times debilitating as this is, I have had much worse before. Neck pain and headaches and elbow, hand, feet pains, etc., all impacted my ability to work properly so much more than this does. It's the current symptom she's having. Part of me isn't prepared to swap it out, even for a short time. I'm trying to convince my brain to let go of that fear. Okay, let's leave this one up also. This brings up an important experience that a lot of people have, which is in my action steps list, I talk about TMS bargaining. TMS, again, is tension myositis syndrome. That's what Dr. Sarno called mind-body issues. What I call TMS bargaining is where people think, I'd rather have this symptom than this symptom. And I'd rather have this symptom than this symptom. And there's a hierarchy, and I have them too. But one thing that I've learned to do is to not stick to that hierarchy, to realize, you know what, the goal is to not have any symptoms, to push back on that. What Natalie's referring to, though, is that a symptom that brings up more doubt is more likely to linger, even if it bothers you less as a symptom. It's a very important distinction. So hers was actually more of a comment, but one that I thought was important to highlight for you all. It really is true. It's not always the symptoms that hurt the most. It's the ones that scare you the most. It's the ones that take over your imagination and make you think you're not going to be able to get rid of that. So that's a good thing to show about how doubt works. We've got a question on YouTube from Julie Ebby. Good to see you, Julie. What do you do for power when your spouse triggers you? Oh, boy. Okay, so listen. Every single one of us on here is familiar, unless we don't have spouses, which some people don't, but those that do those that don't have probably had significant others, so they know too. If you've got a significant other or a spouse, they're going to trigger you a lot. And Julie, what I would ask you is, how do they trigger you? Because there's actually so many ways a spouse can trigger you. My wife, as good a relationship as we have in a lot of ways, there are many ways she can trigger me, and over time we've ironed some of those out. I'll give you one example. One way that she triggers me is her own doubt. She brings her own doubt to a situation, and suddenly I'm saddled not only with my doubt, but with her doubt. So that's just one way that we can be triggered. But I think the more typical way that people think about getting triggered by a spouse is when the spouse does something that fits in their emotions column, fits with one of their themes that gets them really riled up. Now, what I do with them is the same thing that I do with anybody else, though I have to do it more often. I go to the emotions column, and I think about what theme is activated here. I really, what I do is I go through the columns, exact same way. One thing that I might say, though, that's a little bit different, Julie, is you might have to make some kind of adaptation that's going to be different than if somebody who's less involved in your life triggers you and you can just get away from them. There are times, though, where you're going to need to get away from your spouse. And it could be that you decide to have a phone call with a good friend, somebody who doesn't trigger you, somebody who feels safer. And I want to say that it's an important thing to highlight. Your spouse isn't always the safest person. That's not the way it works. A lot of times, the rules of attraction and what brought you to be together, they don't always fit with safety. So there's going to be times where that spouse triggers you more and isn't the safe person. I go to find a safe person or a safe space. Here's another example, Julie. I have used music. Music is a way that I deal with triggers. I go to my own place. I play my guitar. I might just go. It's funny, actually, the place that I play the most is in the closet, ironically. The sound in there is great. It's a small area. And I go in there and I let songs channel things for me. I let myself go there. So what I do is I take care of myself. I recognize the trigger. I decide what I can do about it appropriately. And then I go do it as much as possible. There are times where you can't, but I go for it. Try to figure out what you can do about it. I do see there's a second part of your question, Julie. But, Julie says, I use music. She goes walking. Hey, whatever works. You need to know what works for you. There really are things that work for individual people. Okay, I see Jasper saying hi. Dorothy is saying, I don't want any of it, meaning the symptoms. Just want to go on record. Dorothy has a great sense of humor. So Dorothy, yes, that's the plan. We're working on it. She's actually in my current seminar, so we're doing some good work there. We'll keep working on it. Okay. Rhonda Galone says, same here, Julie, she's actually responding to Julie's statement about her spouse. So I got to read that. And then Carrie, I see your question on Instagram. I'll get to that in a second. So Julie then says, my spouse isn't a talker, doesn't express emotions. I need to sometimes. I've gotten better by telling him how I feel. Okay, So that's a great example, Julie, and that is a triggering thing. I can identify with what you're talking about. My wife is much less of a talker than I am. She sometimes will even say to me, "Why do you always need to talk it through?" And I hear that why, and she actually can sometimes say it in a critical way at a bad moment. She knows not to think about it that way most of the time, but it can get in my head is why do I need to? And what you want to do is you always want to back yourself up. You want to be in your own corner fully, fiercely in your own corner. And I say to myself, no, there's nothing wrong with needing to talk. That doesn't mean there's something wrong with not needing to talk either, but it means we're not fitting together so well, and I am angry about it. So I let myself be angry about it. I take myself out of the situation where I'm stuck in it so much, and then I give myself something. That's a kind of layout that I can say might work. Okay, I think I said hi to Jasper, but I want to say hi again if I didn't. Rhonda says my hubby too with the music. Yep, us guys, we like our music a lot. I suppose there's plenty of women who do as well. Okay, we've got some questions on Instagram. Then I see Matt Anderson's got some questions, and I will get to you in a second. So I'm going to get to Carrie's question on Instagram. Is the symptom profile referring to the people onset, uptick, and chronic symptoms? Hold on, let me read that again. Is the symptom profile referring to the people onset, uptick, and chronic symptoms? Does the symptom profile also provide clues depending on location or how the symptom presents, like pain and dizziness? Okay, so there's two separate questions there. Let me take the first. The way the symptoms profile can mean lots of different things. The way I mean it is, how can we categorize it in whatever way we can? So there's chronic versus acute. There's the onset. I think this is what Carrie is referring to. The onset and uptick in symptoms is a symptom profile that relates to the emotions column. The chronic symptoms is a way of thinking about things in the doubt column, and then plateaus or doubts about the self, that third level doubt, start to slide over into the power column. So that's symptom profiles as it relates to the columns. But your second question, does the symptom profile also provide clues depending on location or how the symptom presents, like pain or dizziness? That's a great question, and I would actually say that that's pretty variable. There are times where it absolutely does. My mom had a case of vertigo recently, and she said that she felt like the world was spinning out of control. There it had meaning. So sometimes the body is translating directly from the metaphor. The times where it isn't, though, are when there's a trigger involved, a direct experience in the environment that gives us a sense of worry, or it raises doubt. So if it's led by doubt, the location and the type of symptom won't matter at all. It doesn't relate to anything, doesn't mean anything. It only relates to the trigger and the experience. But if it comes from the emotions column, or sometimes the power column, the symptoms can matter, how they profile, what they look like, that sort of thing. Please let me know, guys, if I answered that question, and Carrie especially, since it was your question. Okay, one more question from Instagram, then I'll get back to YouTube. This is from Terry. How do you suggest dealing with close family members, Reed, my father, who just don't get the mind-body diagnosis and keep suggesting different MD doctors for you to see? Great question. And first of all, I want to empathize with all of you out there, how much you all deal with in terms of how much people don't understand. By the way, I see Move with Deb joined on Instagram, and so did Mark Campbell. Good to see you, Mark. And Move with Deb, I'm not sure if I've seen you on here. Oh, I think I have actually once, but welcome back. So you're going to get, and what I guess one of the things that I was saying that you're dealing with is all of the naysayers, all the people who are very confused themselves or have their own doubts. Societal understandings are a major problem for getting better when it comes to mind-body process. So I want you to think about it this way. When you are recovering from a mind-body process, you have to decide who you can trust, and you have to shrink the circle of trust. Just about that. So I think of, this is going to sound funny, but here's a way of thinking about it. Terry, when your father starts talking about that, you need to think that he's like a 3-year-old. Just kind of babbling about things. He might as well be just being like, I like Toy Story. You know, he could be saying anything. He's that clueless about it. This is actually another way that relates to how do you channel anger. One way to channel anger here is to know that we know better than those other people. We've learned about this where they have not. So they truly are ignoramuses in this area. We need to think about it that way. So that's one part of how to deal with it. The other part is if they're bothering you enough, you can put in a boundary. You can, and Terry, I know enough to know this may or may not apply to you here, but actually I want to encourage you. You're going to think it doesn't, but I think it can. Sometimes you think you can't put in a boundary with people who overstep boundaries all the time, but channeling aggression can allow you to put a boundary in place in a way that is more forceful and kind of calls them to task more, forces them to deal with themselves more. Here's an example. You might actually say to a person like that, listen, you really aren't taking in what I'm saying. So until you do, I don't want to discuss this anymore. You think you're trying to help, but you're actually not. So this is something I do. I call it, this is something I learned in grad school, but it's commenting on the process. Instead of being stuck in the substance of the kind of surface level argument, you go to the process. What is happening? The what is happening here is you're not listening to me. You're telling me things I don't need to hear and that are incorrect. And we need to figure out a way to deal with that. Sometimes I decide I'm not even going to deal with them, and I kind of just treat them in my mind like they're a 3-year-old, or I might even treat them like they're a horse, or they're just an animal. They're just neighing. And we have to get to a place in our power column where we feel good enough that we can actually dismiss not only these people, but we've got to dismiss doctors who don't understand mind-body stuff, not about life and death things, but about this stuff. We have to learn to dismiss lots and lots of people. Get dismissive. That's my recommendation. An interesting recommendation that most people wouldn't make, but in this case, it is what is needed. Okay, I'm going to go back to YouTube for a question. Welcome back, Matt Anderson. Matt says, do you generally see more people recovering from reaching a baseline of symptom relief and then having the full clarity to reach post-traumatic growth, or more people engaging in a more powerful life because their symptoms begin to dissipate? Great question. Let's leave that up there. I would say that I find more people in the latter category where they... Oh, wait, hold on. Or more people engaging in a more powerful life before. No, actually, sorry. I find more people in the former category. It is more common for people to get to a place where they resolve their symptoms, and through resolving their symptoms, they then feel very empowered. So very frequently, it's about getting rid of the symptoms first. But there are other times where it really is the case that people start engaging in a more powerful life, and that is how they get rid of the symptoms. Again, this is how I discovered the power column, or at least crafted it. And it came out of my knowledge of what happened. For me, I was in that former category. I got very significant relief. And then as I worked to get more, I started to notice I was feeling much more powerful. And that's when I thought there must be a correlation here. So I hope that answered your question, Matt. Let me know if you need more. Julie is adding to the conversation about spouses who don't talk enough. She says, yes, my husband says, did you always talk this much? And then she laughs. So there's some good-natured stuff. And I don't really talk that much. That's an important point, actually. It's all relative. There are going to be people who get accused of needing to talk too much who barely talk at all. So don't let anyone else decide what the standard should be about talking or not talking, about anything. You need what you need. And don't question that. Instead, think about how it can fit. And if it doesn't fit so well with the spouse, don't take that as a sign something's wrong with the relationship or something needs to be done. You may just need to address those feelings separately. Okay, Molly on YouTube is saying, I hate to get all female middle-aged on here, but You're welcome to if you want, though I will protect you from the downside of that statement because it sounds denigrating. But what about symptoms from the dreaded menopause? There's so much controversy on that subject too, and the symptoms. Okay, so first of all, the very first thing I'm going to acknowledge here is that I'm a man. So take it with a grain of salt. Women out there, you're going to need to tell me more about what menopausal symptoms can be like. And I 100% believe that there are we know there are vast physiological changes going on. What I would say, though, is that it wouldn't make any sense whatsoever that the mind-body experience is dominant, and then you go through menopause, and that's all physiological. That's what doesn't make sense to me. What I would say is we should be applying the same standards, and menopause is a huge, huge trigger. So your symptoms are going to go up from triggers, even if they're also going up from menopause. I'll tell you my personal take, but please feel free to push back, women on here. My personal take is that the vast majority of menopausal symptoms are primarily mind-body. Now, keep in mind, I think most things are mind-body. So I'm not saying anything all that controversial when you take into account who I am and what I'm saying. Rhonda says, I'm with you, Molly. Okay, let's see. Jennifer Moore, good to see you on here. Wondering how best to work through pain sensations in the moment. It's a specific point in QL muscle that has a mind of its own, it seems. All right. There's lots to answer in that, Jennifer. So I'll give it my best shot, but I want you to feel free to ask further questions about it. And I also would encourage you to put questions in the comments later if you're looking back and I didn't get to what you wanted. So the best way to work with pain sensations in the moment, I think, is to go through the columns. You want to locate the nature of the problem. Is this happening because an emotional situation is leading to a symptom? And given that it sounds like it's an onset of a symptom that has a mind of its own, it's coming and going a lot, it sounds very emotions column to me. So we'll get to it having a mind of its own in a second. If that pain were always there, I'd be looking in the doubt column. If the pain had gotten a lot better but then plateaued, I'd be looking in the power column. Given the way you're profiling, I'd be looking in the emotions column, and I want to encourage you something. There are so many times where we say to ourselves, oh, but I know, and we kind of dismiss. I know what's going on emotionally, and we dismiss it. Take another look. Trust the body. The body's telling you there is an emotion there. So that muscle does have a mind of its own in a way. I guess a better way to say it is, it has the same mind your whole body has. It's expressing something directly. And you need to think about, if you can, finding a way to trust your body and to take it at its word. It means something. It doesn't have a mind of its own in terms of its randomness. And I think that's what you mean when you say it has a mind of its own. I promise you it makes sense. It always makes sense. So that's one of the first things you need to do, is to throw out the possibility that it doesn't make sense. These things always make sense, I promise you. Let's keep working through it. Okay, let's go back to Instagram for a second. Carrie's responding to the question I answered. She says, yes, thank you. Trying to work out my seasonal allergies, she puts in quotes. I've had them for decades, just major uptick the last couple weeks. Seasonal allergies, in my experience, are always mind-body. There's very few allergies that are not. The only allergies that I find are not mind-body are the ones that are life or death. So things that cause anaphylactic shock, you treat that medically. Anything that's dangerous to your life or altering your physical experience forever, that you need to deal with the medical doctors and follow up with that. Seasonal allergies are one of these things that get blamed for whatever's happening, or I shouldn't even say blamed, but they've become a trigger. That's the way people talk about these things. Okay. Also from Instagram, Move with Deb says, what do you suggest regarding words medical providers say? It can be hard to know who to trust. Absolutely. And Lorraine Preston, good to see you on Instagram, by the way. It is very hard to know who to trust. My rule of thumb is this. You can trust doctors for life or death things. You should have yearly physicals. You should trust them on anything that could be dangerous to your life. They're very good with that. I'm totally comfortable depending on them for that. Outside of that, if they don't understand the mind-body experience, I don't listen to them about anything. They say all kinds of stuff. And why would we listen to them? It's like it's kind of disqualifying. If they don't know the mind-body experience and we're outside of life or death stuff, then it would be like, going to a barber and trusting them on astrophysics. They don't know anything more than anyone else. So what you want to do is categorize what you can trust them on or not. Now, if they are a mind-body informed doctor, you still may need to be a little bit cautious. I have found that there's great doctors in the mind-body field, but they have varying degrees of understanding of various things, and they are potentially very powerful in your life in terms of what they say. Because if a mind-body doctor says something, it could really get you hooked. What I would like you to think about is that there's ultimately one person that you can trust fully with this, and it's you. The second person to trust is me. And the reason is because I factor in doubt and triggers and things that can send you down a bad path. I'm so attuned to that, in fact, that you can trust me more. So you want to start shrinking the circle of trust to a very small group that you can trust. Could be people in this community. Sounds like self-advocacy. Is it? Move with Deb is saying. Well, yes and no, because self-advocacy to me does have a connotation of you're on your own. I don't want that because you get enough of that. So if you need to lean on me, basically think about it this way. Try to find people who make sense all the time. If they don't make sense all the time, you can't listen to them. Find people who make sense all the time. I try to make sense all the time. I think I do make sense. I would say all the time. People can let me know. But don't feel stuck that you're on your own. I'm just saying when I say trust you first, don't forget to evaluate who is earning your trust. And I hope that I am, and we'll keep that up. Okay, back to YouTube questions. Let's see where we are. Dorothy says, must be hard. Actually, I have to figure out what she was responding to here because I fell behind a little bit. Well, I'll see if I can figure it out. My adult children listen to me, stay with me when I cry, and totally get it. I think she's talking about spouses who don't talk. Move with Deb saying, got it. So I'm glad to hear that. So Dorothy, I think, is responding to spouses who don't talk. She says, my adult children listen to me, stay with me when I cry, and totally get it. They don't care what works. They want me to have peace and a resolution to this pain. Listen, I hope this won't sound bad to people. From the having the inside scoop, it's not bad. It's wonderful. The person that I trust the absolute most in my entire life with being able to listen to me and not have all these needs placed on my talking is my 12-year-old daughter. She is the best. And I do this for her too. We just are alike. We are simpatico that way. My other daughter's not like that. I love my other daughter very much. Every bit as much. But we don't have that. My youngest daughter, she and I have different bonds. Our sense of humor can be more similar in certain ways. So it's okay to rely on whoever it is. These are full-blown people. They're important people in our lives. But I have, some best friends that I can rely on. Don't worry if you're not getting everything from your spouse. Nobody does. Okay. Rhonda says Dorothy Hart. She's either liked what she said or sending care. Dorothy then says, I opened up once I started doing this work. These past 2 days have been floodgates opening. I had held back since Ray died. I believe that's her husband, and they lost their dad. And I did not want them burdened worrying about me. Then she said, thank you, Rhonda. So, Dorothy, one thing I want to encourage you is you don't need to protect other people from your pain. Here's a way of being fiercely in your own corner. Let yourself hurt however you hurt. I'm talking emotionally. We don't want to let you hurt physically because we can stop that. But be enough in your own corner, be fiercely in your own corner and fully in your own corner so that whatever your hurt is allowed. You can even let your kids know about it. I let my 12-year-old know about it. I let my 8-year-old know about it. I tell them who I really am. I wish that my parents had told me who they really were a lot more. Things would have made a whole lot more sense and felt better. Okay, I want to say hi to Sylvia on Instagram. Good to see you. Okay, Jasper is saying, is the pain protecting me against playing my instruments? He's an oboe player. As I can become highly critical and negative with myself, perfectionist, high standards. Or is the pain a distraction to emotional trauma and has found the loudest way to do so? Okay, Jasper, I think the best way to clarify this is that the onset of the symptom was emotional. We've talked about that before. In the emotions column work, the onset and uptick in symptoms is emotional. But based on what you're describing, you've got more doubt in there and power. Doubt and power take over more the longer the symptom is kind of stuck there. And being highly critical and negative with yourself, that's a power column thing. So you've got doubt working on things that's causing chronicity, but you've also got your power column being a perfectionist, high standards, self-critical, and some of these are they make for lovely people, but it doesn't make it easy on you. And one thing we're going to have to work on is getting to your core narrative. How did you get to be that perfectionist? There's a how to everything, and there's a specific to everything, and that's a big part of what we want to work on, is to help you see you're not just kind of stuck with general ideas. We do start general. That's the place to start. If you're trying to figure out what's going on, start broad, then hone in. And that's what I do in every column. So again, Jasper, I would say it's more the former than the latter from what you're describing, because you are having a more chronic kind of condition. Now, when there's an uptick, it could relate to something emotional, but it also could just be the power dynamic getting more out of whack. So in this case, because it's longer running, I look in the doubt and power columns, and particularly the power column when it comes to your relationship with yourself. Okay, I see Professor Pixel has joined on Instagram. Good to see you. Okay, Dorothy is referring back to menopause. I'm 65 and never had any menopause issues. Okay, now this is very interesting. But so many friends did. Insomnia, hot flashes, anxiety, emotionally labile. So here's what I think about it. It's a pretty emotional thing, I imagine, to go through menopause. To feel like you are going through something that signifies a change, maybe some kind of feeling of diminishment in some way. I'm not saying that's true, but I could imagine people feeling that. A sense of aging, a sense of mortality, a sense of power going away. How would you not have symptoms? Now, I know Dorothy didn't, but the fact that Dorothy didn't is a sign of how much it should be mind-body. I think it would be kind of weird to say that many, many people have symptoms, but a couple don't. Why? I never stop asking why. So I take Dorothy as information. It gets dismissed as anecdotal, but there's lots of people like Dorothy. And maybe she didn't get so scared about it or didn't have so many feelings about it. Dorothy, I don't want to speak for you because there can be all kinds of reasons why you may or may not have had symptoms there, but the fact that you didn't is important. Julie Abby saying, Dorothy P., you are so lucky. I can imagine a lot of women do feel that way. I think the best way to deal with mind-body symptoms, especially that aren't life or death, is assume they are. I say that TMS or mind-body symptoms are guilty until proven innocent. It's the opposite. And so that's the way I'd think about it. Molly is saying some professionals even say menopause is a disease and one that needs HRT hormone replacement. Personally, I disagree. Rhonda Galone says, wow, a disease. That was my response too. I was like, oh my God. Think of the word disease is a very pejorative word. And it's kind of blaming the sufferer. I really don't like that word for it. And I especially don't like it because a disease implies something that's not very curable. And they don't know that. I'm tired of them talking as if they know so much stuff when often they don't. Carrie's saying there is a book called The Woman's Brain by Sarah McKee. Sounds like that might relate to menopause in some way. But Carrie, let me know if I missed the reference that you were getting to there. Julie Ebby saying menopause sucked for me, many years worth, but I wish I would have had TMS work then. I believe it would have been much easier. I agree, Julie, but the way to think about it, and hopefully this will help, is try not to focus on the regret of it. Try to focus on the information it's giving you. Because if the information gives you a better life going forward, then it wasn't wasted. That I want to highlight that again. If the information gets you a breakthrough, it wasn't wasted. All right. Dorothy P says, yes, Julie, I am lucky. My mom was the same. I think it only fair I got a pass on something. I've had enough crap to deal with. Dorothy, I am happy for you. And listen, the fact that your mom didn't have it would have led to a different expectation. So that's important. What your expectations are going to play a big role. And I should say, again, I want to be a little bit careful here because as a man, I don't feel, that I'm in the best position to comment on this. But as a mind-body expert, I can't help that I'm a man. I can just stick to what I know. And I think that it really does apply very much. Okay, we've got, I see Carrie's commenting on that book, The Woman's Brain by Sarah McKee. She says that the studies show PMS symptoms are related to how socially supported women feel. If not supported, higher PMS symptoms. I imagine the same might be true for menopause. Carrie, I think that's a great piece of information. It's something I have suspected for a long time. Sometimes people can get insulted by it, but I'm not trying to insult anybody, and I'm certainly not trying to say anything that isn't true. But I do think we have to think about what is the data showing. Okay, we've got a couple other people who've joined Instagram. I just want to say hi to them. Caroline Lee Dewey, Anche, good to see you again, and Quilt Hollow, good to see you. Okay. Julie Abbey says, Dorothy P, having a family that is so supported, that is wonderful. It is. I'm glad you had that, Dorothy. And Julie, I hope you have some of that too. And anyone who doesn't have that, let's try to have this community provide some of that. Okay, Sarah Singh says, hi, Dan. My question is a bit big because I like to give you a little bit of history information to help me. Can I please send you an email? Please share your email. Thank you. Okay, so anybody who needs to contact me, it's dan@crushingdoubt.org. Please don't hesitate to get in contact with me. And this would be a good time also to talk a little bit about my seminars. We are in the second seminar right now. I'm seeing a lot of really good gains. I'm seeing people kind of get their footing. And it's really great to see. I continue to hone them. But it is a time where we get everything condensed and get to look at things in a way that very powerfully addresses those columns. And it's a way to essentially have a guide. I'm guiding you through the columns. We build the mind-body map. So if people are interested in signing up, we do have our next seminars coming up. It's Monday, July 19th. Over those 2 weeks, it's Monday through Thursday, and these will be the daytime seminars, 2 p.m. to 3 p.m. Eastern. You can sign up for those at www.crushingdoubt.org. We also have the PDFs there. By the way, I just want to put this out there. We're going to change the name of them. We decided we want to call them the Mind Body Guides. They will have PDF in parentheses so people will know what I'm talking about, but just a little shout out for that. Sarah says, though, and I really need your help. I've cured my chronic lower back pain, but my chronic severe knee issue and symptoms have caused me disability. I need your help to figure it out, please. Absolutely. I would be happy to help you. I'm reading down, and Sarah just saying more. I am aware of TMS, and that is how I cured my back pain, but my knee symptoms are still 10 out of 10 and cause me disability. I want to get your opinion and help. I can't stand or walk due to constant and severe knee burning, pins and needles, hot lava, and very uncomfortable symptoms. So sorry, Sarish. It started after a meniscus injury. I do have degeneration, but my duration and severity is much louder than my medical reports. Okay. Saraj, one thing I will say is everything you're saying is in line with a mind-body issue. I'm 100% certain that you do have that. What you do have, though, that adds to the problem and may have made it harder than back pain are a couple things. One, when people talk about back pain, that in some ways is the easiest of the symptoms to get past because Sarno himself started there. It's like all of the literature talks about that. Not that back pain is easy to get over with, I can tell you by experience. from experience. But you have that doubt that it's in a different place. You also had a direct injury that started it with the torn meniscus. That's a trigger. Then you've got certain symptoms that could feel more worrisome. And the more worried you get, the more you spin. So those are a couple things I want to say. But Sarah, I can guarantee you we can get you better from this. So please do email me. It's dan@crushingdoubt.org. I will get you the help you need. Dorothy says, yes, I've started doing that now with them. Thanks, Dan. I have to go back and see what we were talking about. I'm sorry, Dorothy. I don't remember what I said. You know what's funny is I keep track of what you all say more than what I say. Once I say something, it's gone. I'm on to the next thing. Okay. Let me see if I can piece together what you did mean by that. Yes, I've started doing that now with them. Thanks, Dan. It was about telling your kids about what's really going on. Okay, that's great. I'm glad. You need that support. You deserve that support. And Rhonda says, oh, wow, Dorothy, you're so lucky. Interesting. Susan Miller, good to see you. She says, I never had menopause symptoms, went by, and I didn't notice. So it's another piece of evidence. I do want to say I can't stand when people dismiss anecdotal evidence as if that doesn't mean anything. If it happened, it happened. So then we need to find out why. So don't dismiss any information. Even if it just happened once, it happened once for some reason. Let's be scientists and let's be logical and let's figure out why. Okay, Molly says women that overly drink, they say have worse menopausal symptoms, but then maybe because they overdrink means they have more emotional issues. Really interesting. So, Molly, I would say this. That sounds like one of those things that people have tried to figure out by maybe putting some anecdotal evidence into a label. But if it doesn't always add up, it's wrong. It's an 80% theory. I shouldn't say it's wrong, but I would say it probably is partially right at best. Could be wrong, could be partially right, but it's not 100%. It's not what I call a Kepler theory, where they got the elliptical orbits right and not circular orbits. Dorothy is saying, so sorry, Sarah, sounds awful. One thing I do love about this community is the camaraderie we have and the support for each other. Okay. Dorothy says she can debunk the drinking theory. She drank plenty. And Julie's saying, I don't drink. No correlation to me. So, Molly, your statement, though, I don't want you to feel bad about that. There are so many of these ideas. And you actually had a brilliant read on it because you said maybe they overdrink is correlated with more emotional issues in general. What I will say this is everyone's trying to make a very general idea fit when it's specific, because it's really about belief system more than anything else, and the kind of emotional state of the other person. To me, my theory makes more sense because it is general, but it's a system, and it is designed to be flexible. So if it's emotions column work, you can be emotional in different ways, and it can manifest in different ways. And the doubt column can lead to situations where you have more doubt or more fear in one area versus another. It accounts for differences. Much more flexible. Okay, Sarah says, thank you. I will contact you as I have lost my life in every sense. It's been 8 years and I need your help to cure. I suffered for exactly 8 years, Sarah, so I really do understand. I absolutely can help. I know for sure people are cracking up at the drinking theory and how it's playing out. N Brown 0329, I see you on Instagram. Good to see you. All right, looks like we can actually squeeze in another question from our preloaded questions, which is good because I've been falling behind on that. Let's bring up, actually this question I believe is from Molly. Oh, hold on, we've got a request to be live on the video. So I'm gonna go live with someone from Instagram here. Okay, hopefully that works. Let's see what's happening here. Give me 1 second. Okay, are you there? Can you hear me? There you are. Hi there. Oh, it didn't work. Okay. I saw her briefly. Come back if you want, and thank you for your bravery in coming on. That was great. So let's put up a question from the preloaded questions, and if we have time, we'll bring her back on. We have just a couple minutes left here, so if not, maybe next time. Let's have that question from Molly. My question is about age, and does age really make people feel worse, or is that kind of a myth? So Molly makes a lot of great comments on the YouTube site if you haven't seen her before, and she's been on here before as well. So I appreciate your contributions, Molly. I wanted to highlight this question. I think I told you I was going to put it on here, and let's leave it up there because I do want to think about it some. But one of the things that gets highlighted a lot, and I'm very glad it does, is that there's all these beliefs that we have to sift through. Society's throwing all kinds of beliefs at us. We've had questions today about, what about when doctors say things? What about when spouses trigger? Society is just bombarding us with information. But the interesting thing is they all know less than you do. Just by the fact that you've been exposed to me and you've been thinking about it, and I'm not saying that because I'm so great. I'm just saying that the mind-body experience and the fact that I do a particularly good job with it, I think, means that you're going to know more about this than 99.9999999% of everybody. So you got to give yourself a lot of credit here. And with the question about age does not really make people feel worse. What makes people feel worse is that aging isn't a happy experience, and that makes people feel worse. It's the emotional and cognitive components that drive the pain. Molly, let me know if that answers your question. Okay, we've got a question from Larry Campbell. Pain is more intense in morning than late day for me. Anyone else? Julie Ebby says, Larry Campbell, mine is opposite. Well, don't worry that yours are the opposite. What that means, guys, is that it's all about how your belief system and your experience manifests. Dorothy P says, glad you said that, Larry. I was watching the nighttime symptoms video, and Dan mentioned he did or will be doing an AM one. I'd love to see that one, too. Actually, Dorothy, it's funny because I actually don't remember if I've done the morning one yet. I need to look into that, and if I haven't, I will. There's many different reasons for it. For people who have it intensely in the morning, sometimes they can think, I'm stiff from being in the same position. And then other people can feel, I get pain at night because I've been moving around too much. Think about how directly opposing those ideas are. The thing that is the link between it all is if you believe you're going to have pain and you truly believe it, that's when you will be more likely to have it. So it really is all about the belief system. The timing that you have, think about what it means in terms of what you're thinking. Okay, guys. Oh, that's funny. Dorothy joked. I was fired for that. Love your sense of humor. Guys, it has been a pleasure being with you here. It always goes by so fast, but I'm glad we'll be back next Monday, same time, 6 p.m. Eastern, 3 p.m. Pacific. Thank you so much, everybody. If you haven't already, click subscribe, ring the bell for notifications, hit like if you like what you're hearing, and put your comments below, and I'll get back to you personally. And Brown, who tried to come on Instagram, please come back next time. Let's make that work. That would be great to have you on. Thank you so much for all of the questions and for supporting each other and for your sense of humor. This is a fantastic community. I'm proud of you all, and I look forward to seeing you all soon. Okay, take care.